Welcome to All Sides with Ann Fisher. The Centers for Disease Control and Prevention report that autism rates among children jumped by 15% between 2012 and 2014, continuing a two-decade increase. Karen, why does the CDC track this but not explain it?
So all they do is keep numbers. Mm-hmm. They don't look at the cause, and their numbers can't reveal the cause. They're looking in 8-year-olds. They're not looking in newborns. So there's really no way to use this data to figure out why this is happening, other than, as Mark just said, that we can see now in the last few reports that more kids from minority backgrounds are being diagnosed. And the people I talk to say that's a great thing, because minority kids aren't being left behind as much as they were before.
Well, it's not unexpected because we are refining our ability to identify children with autism. We've had a campaign for the last decade of educating family members to learn the signs and identify early the signs in their children. We've worked with pediatricians on establishing early screening during wellness checks at 18 and 24 months. The CDC report is important because it reminds us that we are not identifying everyone who has autism. And what happens also is the CDC report shows us that the median age at which children are being identified is about 4.5 years old, which is way too late. It's too late for early intervention, early services, where we know we can bend a curve on the core features.
Sorry, I'm the mother of a 17-year-old, soon to be 18-year-old male with autism. My son has autism. My nephew was diagnosed a few years ago with autism. My concern is that, we're saying things like the cost of treating these people, of caring for people with autism over the course of a lifetime is staggering. I don't believe it's sustainable, as we see the rates increasing, and I wonder about the people on the panel if they are concerned about that as well, and identifying causes, because I don't believe this is better diagnosis. This is not something that we had in our family before this generation. We certainly love our children and support them as long as we can, and not to mention the cost of just treating autism symptoms and early identification and remediation, but outcomes are still poor even with that.
Yeah.
Social employment, all of those outcomes are still poor. And not to mention the comorbid conditions that go with autism, the seizure disorders. I have older adults who are developing mitochondrial and other mast cell disorders. They're being diagnosed with that. New syndromes are coming where they
well let's hear what the folks in the studio have to say.
Yeah, and there's autism is complicated for kids and adults who are affected more significantly by autism. There's a lot of areas that need to be addressed. It's related to their functioning in everyday life. It's their social emotional needs. It's helping them gain employment. It's helping them through relationships. It's helping them through mental health issues. So there is a lot to do. We know that the early intervention needs to be as intensive as possible. That's expensive. The CDC report is important because it does help us gauge and calibrate how much money, how much emphasis, how many programs that are run by state agencies, federal monies, how much do we need to really tackle this?
There is a lot of research going on and some significant advances coming in terms of developing a diagnostic marker for autism. There's some things like eye tracking. There are other biologic things in the blood that people are starting to find that can identify autism at an very early age. Some objective marker to say, yes, this child has autism at 3 months, at 6 months, at 9 months, at a year, and start that child in some kind of therapy at that point when it would be the most effective.
Well, I think it's important to work in concert and collaboratively. In addition to agencies, the complexity of autism requires interdisciplinary work, different types of professionals working in concert.
There's that phrase that 18-year-olds on the spectrum fall off the cliff. A lot of times services are no longer available or they're not as easily supported. More and more of my caseload are older. They're young adults or middle-aged adults, and I'm afraid we we have forgotten them in some regard. So no, in fact, it can be even more difficult and harder as systems of support let go of you and focus on younger population.
In the adult service delivery, employment support, post-secondary, we're not doing as much as we should do in providing services and supports for those adults as much as we are with children. That's an area of great need.
I was trying to figure out yesterday what Medicaid coverage there is in this case. I know it's considered a disability, so Medicaid kicks in, but I wasn't clear. I know it differs between states, right?
So a lot of it comes through our boards of developmental disability. So if the person is considered eligible for those services, i.e. having a disability, then they can go on a wait list for a waiver, a Medicaid waiver.
A wait list,
Yeah.
though.
So we do
That's
have
not a good thing.
Yeah, we have a wait list system in Ohio. There's a certain number of slots, and they're distributed across the state to each county, and there are different kinds of waivers. There's kind of lower cost waivers, maybe $5,000 a year, and then there's other waivers that are much more expensive.
In your opinion, what percentage of individuals on the autism spectrum actually receive that type of assistance?
Well, I don't think it's a high percentage, but I don't know the number. I do know that there are often long waits.
We have about, probably estimated prevalence in Ohio. We probably have more than 100,000 people with developmental disability based on our population. But our state and county board system can only really support about 35,000. And so there is a prioritization based on level of care. And unfortunately, people with autism spectrum disorder and don't have co-occurring intellectual disability really fall low on the prioritization in terms of level of care. And that's a challenge we have right now especially with young adults, is providing them with supports and providing them with services when they may not qualify for a developmental disabilities waiver. And some of these services and care can be expensive for the family.
Right.
And I agree. And I would say, too, that the severity of the need is no less if you don't have intellectual deficits. In other words, the other concerns you have are debilitating. And one of the interesting findings of the report is that, and this statement may sound weird, but like we're getting smarter. In other words, the level of IQ of individuals diagnosed with autism, 70% is, above 85 IQ and above. Before, we used to think it was automatically below, 85 or in the 70 range. That's only 30%. And there's almost 40% of individuals on the spectrum that are average to above average.
And yet they're less likely to
receive services.
To receive services.
But the debilitating effect is just as powerful.
So we need to keep focusing on those supports.
So the data's been behind the curve and is just catching up, and likewise the support systems and funding for the support systems are way behind the curve then.
I think there's a struggle for that too. So families do have insurance lots of times, and there has been advocacy federally to get more coverage for individuals with autism, including the family support. So there are better and better kind of benefits within families' insurance plans, and there in Ohio we just passed an autism parity law that clarifies that autism cannot be an exclusion on insurance. So in the past we used to find that almost 50% of families coming to us, along the list of things that were excluded for coverage was autism care, which was just kind of mind-boggling. But now that is not legal in Ohio, and in fact more services, including intensive services, are covered. So families could potentially access some of that. And I think Medicaid is looking at what do families need for kids with autism that isn't really clarified within our state plan, but could become more beneficial and provide more clear supports for autism if a family has Medicaid benefits. I don't know, maybe 6 years ago or so, I don't know, maybe the others have a better timeline, but I think when Asperger's disorder became much more prevalent and talked about, people with Asperger's syndrome moved forward to have a voice, and so have been self-advocating and talking about their right to be respected, their right to be considered different, not imperfect, and all
That
of
it's
these.
not inherently a bad thing.
Right, and
Yeah.
that it's a difference that they have that they can move through life with and might not want to change.
And they pushed against a lot of the professionals in the scientific community against this emphasis and almost sole drive and focus to find a cure. And they reminded us that there are a lot of adults with autism and they don't need to be stamped out or cured. That
In 10 or 15 years down the road, where are people going to live? How are they going to be situated? What about when their parents pass? Who's going to take care of them?
The days of there being sort of separated facilities for people to live in are really over.
I love you too.
The real life decision that I have is, do I continue to try and find people? Do I quit my job so that I, can stay home with her and take care of her? Or do I put her in an institution? And obviously that last one, it's not an option for me. That's not where she belongs. She belongs here at home and in her community.
there is a movement among many parents of young adults with autism who feel that the system has sort of abandoned them and is not helping their son and daughter. And there's this movement right now that we're seeing across the country and in Ohio of parents coming together and trying to identify planned communities.
For most of us, turning 21 is a time to celebrate with college graduation and the start of a career. But for someone on the autism spectrum, turning 21 can trigger a year-long countdown of uncertainty and sometimes despair.
That's because they're months away from aging out of many publicly funded services. Families call it falling off the cliff, autism's cliff to nowhere.
A so-called tsunami. Some 500,000 young adults with autism are turning 22 in the next 5 years, reaching that services cliff, aging out of publicly funded schools and services.
Intentional community. It's very inclusive and it's a seamless, lifestyle, but the needs of the individuals are, addressed appropriately so.
The state and the Department of Developmental Disabilities is really creating a substandard level of care for a population of people who really are the most vulnerable. They don't have the ability to speak out. They don't have the ability to stop somebody to tell them, hey, wait, you're doing that wrong. All they see are their budgets and their bottom lines, and they've lost sight of the individuals that they serve. They're not seeing the people behind those dollar signs.
These people are coming into the community. We have got to do something with this system. It's got to get better.
Pat in Upper Arlington, you're on the air. Hi, Pat.
Well, I just wondered, I hear a lot of people talking about how they're treating autism and a lot of programs that I think are wonderful for people with autism, but I don't hear anybody talking about what caused it. And I have only to say I'm 88 years old, and I grew up in a neighborhood outside of Pittsburgh. I knew everybody in my class. We all graduated from one boy was sent to military school because he was stealing cars and he got in trouble. But I can actually say I don't remember anybody that had autism.
One issue here at hand is that a lot of those individuals, those children, those adults were there. We just called it something else. We called it intellectual disability. We called it schizoid affective disorder. We called it just being odd or
And they were
socially
also
aloof.
put away a lot of times back maybe when Pat was in grade school or high school. Back then, things were very different how they were treated.
There was a special class for students when I was growing up.
Well, there's special
and-
hospitals and yeah.
You knew they were different. You knew they were odd. You just didn't stop to think that they had a condition.
And New Jersey is still increasing, and that's something that we can't explain.
There was some work in California that tried to tease that out, like what's the prevalence versus the incidence.
Right.
Or the prevalence is how many we're identifying, and the incidence is the actual occurrences. And in California, they're able to gather all kinds of information and data about people with disabilities becoming diagnosed. And in one of the reports back then, I think that was maybe 6 or 10 years ago, they really felt like a large part of the increase was related to us better identifying kids that had either not been identified at all with anything or had been categorized in a different category, often maybe categorized in 3 other categories. So they have ADHD and oppositional behavior and social deficits. And really they could have been characterized as having autism. But they did leave some room to say, is there something else causing an increase? I think we just don't know. Yeah, we just don't know.
I also want to add, so in terms of what causes autism, we know there's a heavy genetic loading, but and we've identified, hundreds of candidate genes that seem to be associated. But, again, autism is really plural, and there definitely is not one gene or one genetic disorder.
I think we're working hard to what they call phenotype autism. So that's in the genetic syndromes world. That means what does this syndrome look like? And so in the genetic research, what they have found is that if we're looking for one candidate gene, we're just not finding it for autism. So there must be many that play together that end up causing autism. And because autism can present in such a different way, if we could categorize them into types, it would be much more helpful than our genetic research, because we would see that this genetic problem causes this kind of autism and this other one causes a different kind of autism. But they don't have it clarified that there are, say, 10 types or anything like that.
And they're also, in addition to genetic loading, there is an interaction with the environment or epigenetics, because we know that even in the studies done with monozygotic twins or identical twins who have identical genetic makeup, there are some studies that have shown that not both children will have autism. So although they have the same genetic makeup, one may have autism and the other one may not.